Good morning, guys. I hope we're all sparkly. Just doing a quick video in between patients. Well, on my break. Working on my break. No rest for the wicked. I was told off for being too scruffy in the last two videos. Who by? Yeah, you guessed it. Her Royal Highness. So I thought I'd do one dressed in my work clothes. Now, I can't avoid dog hairs. I have German Shepherds that molt all year round. So unless I'm going to be anally retentive and clean, which I'm not, there will be hairs. So it is what it is. Listen, it's hard being a man in our society, especially as our society is disintegrating. But we're supposed to be all things to all people. We're supposed to be strong. We're supposed to be the protectors, but we're also supposed to be kind and considerate and empathetic. Now, that should come relatively naturally, but in a weird world, it's quite difficult. So there's that phrase, isn't there? It's better to be a warrior in a garden than a gardener in a war. And that's true. But we're in the garden and we're warriors. It's a big old garden. And we struggle. We struggle to be men. So what should we do? Well, lots of us do naughty things because we are testosterone, aka dopamine driven, and we take the path of least resistance, maximum reward. But that maximum reward is short-lived because it's not what our physiology wants us to do. So we end up in trouble and we end up with low testosterone. How does that make us feel? Awful, low mood, low self-esteem, no self-confidence. So then you go on testosterone replacement therapy, the catalyst for change, testosterone, the foundation hormone for normal physiology. How do you feel with that? Well, hopefully you become you again. You become the person that you should be, who you want to be, who you need to be. Obviously with a better perspective. Now, sometimes your partner may not like that. They may like the submissive, passive you. And we know that females are more estradiol dominant, which means they're more serotonin dominant, which means they are the nurturers. Okay, so they're bringing up the children and you become a bit of a child to them. And they sometimes quite like that, weirdly. But you become you again, and that's not quite so nice. So this works both ways. So listen, just be the best version of yourself, whether you're a male or a female. It doesn't matter. Be the best version of yourself. And if you're in a relationship, a loving, committed relationship, that will work for you, not against you. But one of my patients today is in a bit of trouble. Well, he's not in a bit of trouble, but he was potentially in a bit of trouble, because his missus thinks he's aggressive on testosterone replacement therapy. Nobody else does. The other family members, friends and family, just his missus. And there is a backstory to this, and there's an agenda, so we won't go into that, but just let me reassure you that testosterone does not make you aggressive. So she claimed something very bad. The police turned up, arrested him. They investigated. They watched the CCTV camera and apologized to my patient and went on their way. It's difficult being a man because we will always be the ones to blame and we're always guilty until proven innocent. Because it is perhaps a female dominant world, weirdly. But it is what it is. We have to still stand up and still act in the best interests of ourselves and others, understanding the mirror concept, and deal with the adversity and be men. So, in a burning building, there are no feminists. You can be what you want to be, but I will be what I want to be as well. So it doesn't mean I'm a chauvinist pig, because obviously I'm tongue-in-cheek when I say feminist. No feminists in a burning building. Lydia is a strong, independent woman. And so we always have this bit of a joke. But I say, right, okay, she says she'll be the last person to leave. And so, well, you'll be leaving before me, and then know that because I will throw you out. So as strong, as independent as you are, I will make sure you are safe over me, because I am the man. Okay, that literally is it. My role is to protect, and I will do that. So it goes down well. Be who you are. Okay, super important. Now, society is disintegrating, disappointingly. We have men who want to be women, and they take hormones for this to happen, because fundamentally we are our hormones. Are we? Well, we're our hormones and our genetics. You can't change genetics. So transitioning from male to female and suppressing testosterone and raising estradiol, that can't be good for you. So we know anecdotally men with low testosterone and relative high estradiol feel rubbish, obviously, because testosterone is necessary for brain function, physical function, everything. So high estradiol, anxiety, emotional states. On TRT with healthy testosterone and raised estradiol levels, people feel rubbish, anxious and emotional. So that can't be a good thing. And conversely, if you have a male wanting to be a female and you have low testosterone, a female wanting to be a male, I get confused. This isn't something we should be confused about. A female wanting to be a male. So you give her testosterone and you suppress estradiol. Well, the rise in testosterone is going to make her feel great temporarily, because testosterone and dopamine, reward, yeah, wonderful. Then downregulation, because the body survives on the concept of what? Balance. You need contrast to establish harmony. Basic principles of life. You suppress estradiol. Estradiol is necessary for brain health, cardiovascular health, the list goes on. So defying physiology, defying nature is slightly absurd. But we have to accept people's rights to be who they want to be. Do we? I don't know. Apparently. There you go. So you may notice that TMHC is not a politically correct place to be, but it is true. It is 100% authentic, and we will always act in your best interests, because that should be the premise behind any doctor's role, acting in the patient's best interests. So we have these wonderful, I don't know what else to say really. I mean, honestly, testosterone is fundamental to health. Low testosterone is not a nice place to be. Healthy testosterone levels, with TRT being the catalyst, will allow you to be cool, calm and considered, and hopefully be the person you're supposed to be. Effort equals reward.